So, Bethany, please tell me your full name and how long you've lived in New Orleans.
Bethany Ewald Bultman, and I grew up in Natchez, Mississippi, which is 3 hours and about 100 years in a different time zone than New Orleans, and so I used to come here a lot. I started living here full time in 1967 and have been here ever since. But my happiest memory was when I was 7 years old. I came here for the first time that I remember, and I got to sit on Santa's lap. And when he said, "What do you want for Christmas?" I said, "I want to be Queen of the French Quarter." And many years later, when I was Queen of Crew de Vue and I was, reigning on the float and waving at everybody, I thought, Santa's wishes do come true. Sometimes they're not in the same time frame you want, but they will come true. I was so happy.
Oh, that is fantastic.
Yes.
So I was in Crew de Vue 1 year, 1 year only. It was the year after I had my daughter. So it was in 1998.
Wow.
It was a lot of fun.
When people ask me if it was a surprise to be the Queen of Crew de Vue, I say yes, because I wasn't in the crew. That was really a surprise.
That's a big surprise.
When people from the crew show up and say, "We would like you to be our queen," I went, "Me? You want me?" So that was fabulous.
Would you explain Crew de Vue to people? Because I don't know that it's a well-known crew.
Well, it's the only Mardi Gras crew that still parades in the French Quarter, and it is the most open, funky, irreverent, fabulous, wonderful. It's like what Carnival was in the 19th century. And, it's just a cross-section of all kind of different people, and it is so much fun. It's not where you would take your maiden aunt who's a librarian from the Midwest. I would not suggest that. But anybody else would have a good time. My horror was, as I was beginning to parade, I looked up and I realized that the women that were dressed as nuns were nuns, and they were all from the Daughters of Charity, and they were nuns that I worked with a lot in hospice. And I went, "Oh, this is not a good idea." And they said, "We wanted to see you be queen." And I said, "Well, now you've seen me. You really need to go now," because I knew what was coming up behind me. A copulating cow. I thought this was not something these nuns ought to see.
So tell me a little bit about your role in New Orleans. What do you do in New Orleans?
Well, what I started out doing is being a journalist, and I got a job very soon. I realized I couldn't make a living as a writer in New Orleans, so I ended up becoming an editor at House and Garden, which was kind of, random, and I kept thinking they'll figure out pretty soon that I know nothing. But anyway, I did get that job. So I felt like Robin Hood because I made a lot of money doing articles about the value impaired, and then I would write locally about the culture that I loved. And so I had this commuting, weird life, and it just would stagger me that I got paid a lot of money to write articles about the untimely death of some legend of American music that died of things that could have been prevented, should have been treated. And I know that I got paid more than they made in the past year to write these sad stories. And it would upset me a great deal. My husband's family had been in the funeral business in New Orleans for a long time. And I also knew that when these legends died, they had no money to bury them, and oftentimes the casket would come from us. No, we would give the family the casket, and it just seems such an awful system. And so when we got the opportunity to create a clinic, I wanted to be part of it, even though I came from the background of being an anthropologist. I didn't come from healthcare, I didn't come from public health, I didn't come from sociology. But I knew a lot about the music and culture of New Orleans because I loved it, and I knew what didn't work. And I wanted to make sure that the future generations didn't have those awful disparities to overcome.
So I want to dive into that a little bit deeper, but before we do that, I wanted to ask you, so that we have it actually on camera, what is so special about the music in New Orleans?
It comes out of the ground. I mean, it truly comes out of the neighborhoods, the ground, the churches. Families for generations have been musicians. And this is the birthplace of American music in New Orleans. On a given weekend, you can go to a second line parade and hear wonderful jazz in the streets. You can go see Mardi Gras Indians parading with their African and Caribbean rhythms. You can go and hear gypsy jazz in a club on Frenchman Street. You can then go to a Cajun dance and see old people with walkers, can barely get there, and they put the walkers down and they get up and they just dance like crazy. You can go to a gospel church and have people dancing in the aisles, and that's just on a given weekend. And there's so many other nuances of culture, but it really does come out of the neighborhoods, the community, and the culture, and it's been here for hundreds of years.
Tell us a little bit about second lines. People hear second line. Do they know what it means? What does a second line really mean? What is it?
Well, let's go back to with the social aid and pleasure clubs of over 100 years ago, because whole families would die of cholera, yellow fever. And so these were societies that would own tombs, but everybody would pay in to this society, social aid and pleasure club, and then once a year they would have everybody dress up, hire brass bands, and have parades in the street. And it was a way to gather new members, and people say, oh, that looks like a fun group, I want to be part of it. So we have social aid and pleasure clubs that are 130 years old. And they no longer have the tunes that they used to have, and they no longer have these funds for burial. But they're still a great part of the community, and historically, every one of the social aid and pleasure clubs has a parade on a given day. Last weekend I went to 2 second lines. It's just so much fun because everybody comes out of their houses and they dance behind the brass bands, and often the parade takes 5 hours to weave around and stop at different bars. It's a lot of fun.
So I'd like to talk about the work you're doing now. Would you explain to us how you started? Because you started the New Orleans Musician Clinic before Katrina.
Right. The Musicians Clinic, I have to say, things happen in an amazing way. And our clinic was founded because of a Fish concert.
Oh, you so have to go into this. My partner is a huge Fish head. I need to get all this on tape.
Okay,
Oh,
all right,
this is just
okay.
going to make his day. This is going to make his year.
Okay, so Fish played in New Orleans at Jazz Fest in 1996. And if you know anything about Fish, you know that there are a lot of Trustafarians that follow Fish, and they're marauding through the French Quarter in sarongs, stoned with their daddy's gold cards. It was quite special. And the local people were just like, oh my God, who got this idea? This is horrible. Like, what has happened to our city? Because it's just like mobs of the Fish folk were here. So my husband was chairman of the board of Jazz and Heritage at the time, and he said, we really should go to this particular concert. And I thought, just shoot me now. Like, just please kill me now. And so we did go, and just like, oh no, this is just awful. Anyway, so then they announced that they have a special guest. And so you just heard people say, oh, it's going to be Bruce Springsteen, it's going to be Jimmy Buffett, it's going to be blah, blah, blah. Well, this very dapper older man who looked a little bit, if you remember Ross Perot, looked a little bit like Ross Perot, comes out with a banjo And Paige McConnell, the keyboard player, said, "This is my dad."
Oh.
And Dad, Jack, comes out and he plays the one, I now know it's the one song he knows, "Won't You Come Home, Bill Bailey." And so while Jack was out on the stage at Jazz Fest with Fish playing "Won't You Come Home, Bill Bailey," he had this amazing epiphany as he was playing. There was a line in the song, and he thought, this is the birthplace of American music, but it's an early grave for every single one of these musicians. Jack is one of the largest traditional jazz fans on the planet, I now know. But you know, with great epiphanies, what do you do with it? You know, he's out playing this song. I mean, and he goes back to Hilton Head, South Carolina, where he and his wife had retired. And so he just kept thinking about that. Now, the thing about Jack, beside being Paige McConnell's father, that you need to know is that he's a physician who had grown up the son of a preacher in North Carolina. He had then worked for I think it was Johnson & Johnson. He had worked on the commercial MRI, encapsulated Tylenol. And once he retired to Hilton Head, he would see all these retired physicians on the golf course. And he'd say, is this really how you want to spend the next 30 years playing golf in Hilton Head? I mean, don't you want to be doing something? And he said, look around you. There are all these workers in this resort, and they get on, they're bussing them in. They don't have any health care. They don't have any benefits. What do you think we ought to do about it? And they were like, look, I'm here to play golf, you know, like, just leave me alone. And so the more he engaged these doctors and said, why did you become a doctor? Why did you really become a doctor? And then they would talk about their frustrations. You know, there was all this malpractice insurance, and you can't retire, and you can't really take care of anybody because you have to keep paying your malpractice insurance, but you don't have any income, blah, 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 blah. And Jack said, okay, we need to get a law passed so retired physicians and nurses and body workers and dentists can all be covered. And so Jack worked with Katzenbaum and Kennedy to get the Kennedy-Katzenbaum bill passed. Jack had then created Volunteers in Medicine. So when he played in New Orleans, he was already working on the Kennedy-Katzenbaum bill. He was already beginning to create Volunteers in Medicine, but he really wanted to do something in New Orleans. And that summer, after the Fish concert, he was at a cocktail party in Hilton Head, and one of his friends said, I want to introduce you to Sybil Morial. Her son is the mayor of New Orleans. Her late husband was the mayor of New Orleans. And you know, you ought to tell her about your vision, you know, of what you want to do. So when he met Sybil, she said, if you come to New Orleans, I'll set up a coalition of people who will take this forward. So she introduced him to my husband, who is, as I said, chairman of the board of Jazz and Heritage. But he also worked with the Daughters of Charity, which is the largest and oldest not-for-profit, mission-driven health service in our country. And so he worked with the Daughters of Charity, and he was also on the board of the LSU Medical School. So he was able to put those partners together. We met with Jack, and we felt in the beginning, you know, this whole group of people that got together, that Volunteers in Medicine was probably not an appropriate model for the kind of health care that we would need to set up here. We felt like working within academic medicine would be more important because we needed to have the research components, and we needed to have, like the old family doctor, you know, we needed to have the consistency. And we didn't want to be episodic because we realized that there was a culture in New Orleans of rather poor health-seeking patterns where this is anthropological, but it was booze or the Bible. If you had something wrong, you just juice up whichever one didn't seem to be working, and you know, by the time you ramped them up to the fever pitch, you were generally in stage 4 of cancer. And it was really hard to see people end up at the emergency room at Charity Hospital without going through anything else. So we started working with Jack, who was just an incredible person. And I spent more time with Paige from Fish, and they came up with the idea that we should really do a benefit CD. And they said, you know, but we would really be embarrassed to come to New Orleans unless the band that we most esteem, which is the Meters, would actually invite us to come, because that we would feel like carpetbaggers and we wouldn't want to come. So I call up the Meters and I go, George, listen, would you do me a favor and would you invite Fish, please? And he goes, what's Fish? And I said, please, please, please. I mean, I know that you do a lot of jam band stuff all over the country. And here's what you need to say. You need to say you've always wanted to play with them, that you love their music. And he goes, okay, I'll do it, I'll do it. He said, we have this tour coming up and, you know, I'll definitely do it. And so a month later, I see George and he said, okay, I did it. And I went, well, what did they say? And he said, well, they said, we're not Fish, we're Widespread Panic. He said, those white kids all look alike to me. But anyway, it took a couple of more tries to finally get George to ask the right band, but he did finally. And so they did come, and they created this really great song together, and it's on our benefit CD. So, you know, in the meantime, getting the Kennedy Katzenbaum bill, besides getting Fish to record a benefit CD for us, the Kennedy Katzenbaum bill was really, really important. And funnily enough, our governor, whose name will not be ever uttered here, the one who has destroyed the health care of our state, that governor, he was the second in command under Tommy Thompson in the Bush administration, and he's the one who quarterbacked the Kennedy Katzenbaum bill. So, you know, I have to say we got to give the devil his due, because he did do some really good things in health care before he decided that we would get what I call Calcutta care for Louisiana.
Wow. So that's an amazing trajectory. Thank you.
Yeah, I know.
So tell me a little bit, the services that you were providing then for musicians after this bill was passed, after you were able to set up and you had some funds. Tell me a little bit about the early origins, and then walk us through to where you are now.
Well, in the beginning, we started out with a needs assessment, and we wanted to build a clinic that our musicians would actually feel comfortable using. And we started out with a nurse practitioner, which back in those days was an unusual concept, but we wanted the ability when someone came in to spend half an hour, not 10 minutes with the provider, but you know, a substantial amount of time so that it was a dialogue. I was already working with the Performing Arts Medicine Association, which is an international organization that does occupational health care, like what kind of mouthpiece someone who plays the saxophone would want, you know, this kind of nerdy stuff. But how do you incorporate that with someone who has 3 chronic conditions, diabetes, hypertension, and depression? So if you're not taking care of your chronic conditions, having the right mouthpiece really isn't going to change your outcome. We were looking at a lot of what was in literature, but then there was a disparity in New Orleans. We have the highest lung cancer rate for African American males in coastal Louisiana. It's a higher rate than they've got in North Korea. I mean, it's horrible. So one of our issues is prevent death by lifestyle. at the same time, if we are ever perceived as a lifestyle police, nobody's going to come. So in the beginning, we expected that the minute we would announce that we had a clinic and we had staff and it was within the LSU Medical Center and we had 16 subspecialties, that suddenly the floodgates would open and there would be lines of people. Well, we were completely underwhelmed in the beginning. And tragically, the only people who came to the clinic were people who were in stage 4 cancers. So a lot of what our staff had to do in the very beginning was a high level of hospice care for young people with head and neck cancers, because we have a very high rate of head and neck cancers in this area. We were working a lot with the Daughters of Charity with their hospice that I mentioned that my husband had helped found. And we were also working with the pharmaceutical companies getting patient assistance programs, because we also found out that a lot of our patients who had been clean and sober for many years had Hep C, which is a death sentence. And so we wanted to get these patient assistance programs, which would pay for $25,000, $30,000 per patient per year on the interferon treatments. You know, this is in the late 1990s. And we would chase drug reps down. I mean, honest to God, we'd find out their home addresses and ring the doorbell. Hey, we really need this. We need this. We need this. And around that time, the pharmaceutical industry passed a bill that they get a 200% write-off for every medication they give away. And they still do, 200%. So we thought, well, we are your best friends. Boy, can we give some drugs away, but it's an issue of filling out the paperwork. So we realized very quickly that as part of healthcare, we had to have social services, and we had to have a very culturally sensitive, culturally competent social worker to do intake, because a lot of times we would find out that the musician was living in their car. So how do we do housing? Because you're not really doing good healthcare if people don't have access to clean water. So it was about becoming more integrated in the community, to have the buy-in from the Mardi Gras Indian chiefs, so that the Mardi Gras Indian chief would say to his gang, it would be a good idea if you guys go to the podiatrist, because 3 of you got diabetes and you don't want to end up with a blister at the end of Mardi Gras Day. I mean, these are kind of basic understanding what would help encourage. So that was where we were before Katrina. And the end of August, it was kind of a slow day at the clinic. We were downtown, and the day, our managing director left that Friday afternoon, locked her file cabinets and walked out. We were never in that building again. We had paper medical records. The whole medical center had paper records. All of the staff had LSU Medical Center email addresses, and all of our phones were all related into the LSU system. And within 4 days after that, we had no server, we had no email, we had no phone contact, we had no way to reach anybody, and every single one of our patients had been sucked out of this city by the federal government with no plan to bring them back. So that was where we were in 2005. Nothing. We had absolutely nothing. We had no healthcare system, we had no charity hospital, and all of our people were gone. So it meant that we had to not only start over from scratch, it was starting over from scratch thinking that the Red Cross, FEMA, the federal government was really going to be there. And slowly but surely we realized we have to do this ourselves because nobody's coming to help us.
When did that realization hit?
I don't think it's really hit me yet. I mean, when we had to go through the Katrina thing, and there's several other not-for-profit directors, and we started 2 years before the Katrina anniversary getting requests from media from all over the world. You know, can we sit down with you? We're going to bring a crew in. And our first response was, why would we want to go back? You know, we don't want to talk about this. We really don't want to talk about this. It's painful. We don't, you know, this 10-year anniversary, we're worried that our patients are going to commit suicide. We're worried that it's just going to dredge up things that are going to be horrible. And we have enough issues to deal with beside bringing those back. But a group of us decided that we had to do it, to witness for those people who couldn't speak for themselves. We had to talk about what disparity we had before and what disparity we have now. And I don't care what lipstick you want to put on the pig, baby, it's still a pig. And, you know, not to be negative, but to just say, this is what happened. And we have all moved on from there, but those problems are still there.
Describe some of the specifics of those problems.
Well, I keep bringing up the term healthcare disparity. And if you go to the Center for Disease Control healthcare report card and look up Orleans, it is staggering, the breast cancer rate, the death rate, or the infant mortality rate, or currently what our AIDS rates are. Our HIV cases in teenagers is just catastrophic here. So we have a very broken public health system. And it is made a lot worse from the fact that we have not had a public hospital system since 2005. Louisiana had a unique system before because everybody in Louisiana since the time of Huey Long during the Depression had access to health care. That doesn't mean you had the availability of health care. It meant theoretically. So it meant if you needed a colonoscopy, for example, you could get an appointment in 3 years. However, and this is still the case, if you have a gunshot wound, you get taken to the emergency room and the state gets what's called federal disproportionate share dollars, which is a very high rate of compensation. The state then doesn't have to use it for health care. So they can take that money and they can build a bridge, they can use it for the state plane, they can have a parade. They can do whatever they want with it. So if you also look at how much money is spent per patient for health care in our area, it's the highest in the nation. But none of that really filters down into helping the health care. So let's look back at what happened during Katrina. We had, I mean, this is just off the top of my head because we lost all our medical records, but we had, that I personally was involved with, 10 patients who were in the middle of having chemotherapy for cancer. Now, where those 10 patients were, not only that, we knew what kind of cancer, but not any detail of what the specifics of their cancers were. So immediately I started thinking, making a little list on legal paper, where is so-and-so, where is so-and-so, where is so-and-so, where could their doctors be? Because, you know, they're in the middle of chemotherapy. Did they get out? You know, I knew that they were living in places and their homes were really destroyed. And trying to anticipate, where could they be? You know, who do I know that knows them? Did they have family in Baton Rouge? You know, what could I do to try to find them? I luckily had an AOL email address. I didn't use it very much, but I did have an AOL email address. And I was at home with my mother in Natchez, Mississippi, where the Katrina actually went. It didn't come here. And so I had the ability on dial-up to either be on the phone or be on the computer. And so I started sending emails out, and I started trying to find people. And in the beginning, I might send out 30 emails. By the fourth day, I was getting 600 emails. I was just getting so many because people would tell people that I was there, and people said, look, if I send you money, if I send you money, can you get money to so-and-so? Can you do this? Can you do that? And so I thought, I'll go to Lafayette because that's in Louisiana, and if I can start getting people back to Louisiana, then eventually we can come back to New Orleans, because it was really a fear that I had that New Orleans culture would never come back. And that if we couldn't get people back to New Orleans, or at least to Lafayette very soon, it was going to be over. And the thing that really got me going in the beginning were those 10 people. How could I use the resources that I had through Performing Arts Medicine Association? I mean, like, I knew doctors all over because I would go to the conference. And I thought, well, at least they care about performers. And then I had Jack McConnell, Dr. McConnell, and he created these volunteers in medicine clinics. And I think by then there were maybe, I'd say 2 to 3 dozen clinics around the country. So if I could find out that someone was in, a lot of people ended up in like New Mexico and weird, why? Oklahoma, New Mexico. So if I could find where they were, and I started getting a lot of money from people because they knew that the clinic had existed before. So we were known. I decided that I would convert it to Walmart gift cards. We didn't have any mail service. We didn't have mail service for a long time, but we did have some FedEx. So, I mean, every time there was money in the bank, I would send volunteers out to Walmart, and we were getting a large amount of gift cards. We got investigated for money laundering. Yes, we did. And they came in, like in suits with guns. I said, really? Do we look like a money laundering operation? I mean, really, come on. Like, well, we need to take you in. And I said, I really do not have time to be taken in anywhere. Like, we need to do this now. So we were able, of that 10 patients, to come up with facilities who generously would take them in and house their families in places all over to make sure that they completed the treatments that they needed. And there were cancer centers in Baton Rouge who got whole portable chemo units and would send them into shopping malls, trying to help people. I think that there was so much, when you say, did we realize how bad things were? No, we didn't, because we really and truly thought, as soon as people get it, there's a system that will come in to help. And no, that system has never come back. And that nameless governor took every single one of our public hospitals and either closed them or privatized them. So they will never come back. And all of our mental health facilities have been closed. The only large mental health facility we have is in our parish prison. So if you're mentally ill, chances are where you will end up for treatment is jail.
So this is huge. It's almost overwhelming to think about.
That's why we don't like to think about it. We really don't like to think about it or talk about it.
I think it's important that people understand it, though, because there is I think if you don't have that history or you haven't lived in this area, it's just really difficult for people to understand the complexity of the situations you're describing.
Yeah.
So that raises another question for me. We keep hearing in our interviews that so many people are moving to New Orleans and have moved to New Orleans from all over the U.S. and the world, actually. Do they understand what they're moving into?
I want to say that everybody has their dream, their vision, and their sense that they're going to come here. And I don't know if this analogy works, but this is just how I think of it. I was very fortunate when I worked at House and Garden to spend a lot of time with Lady Bird Johnson. And I spent a lot of time at the Wildflower Center in Austin that she created. And one of the things I learned is that people moved out to Arizona because they had terrible allergies and asthma when they lived in, upstate New York. What's the first thing they did when they got to Arizona? They decided to duplicate the front yard they had in the house they grew up. And so suddenly they have terrible problems with allergies and asthma. That's how I view the people who come to New Orleans. It's like not my problem. I see this happening. I see that they are displacing the members of the Social Aid and Pleasure Club who can't live here anymore because they can't afford it, so they're living in Baton Rouge. Mardi Gras Indians who are living in Houston, and they are living in apartments that have one lawn chair and a card table, and they sit there and they sew their suits, and they come back on the bus with their suits, and then they go back to Houston. And it's very sad. I mean, it upsets me a lot. I had an experience after Katrina that I met with the Lutheran leaders at St. Peter's in New York. They're the church that have had a jazz program for 60 years, and they sell their air rights to Citicorp. And I went to them and I said, I am trying to start a clinic again. I really need some good leadership. I need some people who could come in to help, and who do you have, and would your church be interested in this mission? And every one of them said something wonderful to me. They said that everyone had been in a parish that had been destroyed by a tornado, a fire, a flood, or something. And they said, you are the leader that needs to do this. That's number one. But you don't have to do it forever, because you're going to know when the time has come to walk away. Your job is to sustain, and you need to know that you can never put it back the way it was, and you will not be able to control the outcome, so know that. Know that the very people you need to work with to get it back to a point are the very people who don't share your vision. So, in a way, it kind of gave me this bulletproof sense. It's like, okay, hipsters are moving in, they don't understand our food, they dress funny, they're value impaired douchebags. You know what? Not my problem. It's like not my problem. They're going to pay taxes. They're going to be aerialists or magicians or whatever they are, and they're going to come use our clinic. And guess what? They're going to have insurance, so we get reimbursed for their care. It is not why I created the clinic, but why we created the clinic was also to take care of performers. And so, as I say, I was told a long time ago I can't control the outcome, and so I'm not worried about it. I mean, I'm deeply saddened by it, but it's just something that's not on the list of things I believe I can improve upon.
So tell us about the things that you are focused on right now, and what is happening that you are working toward, the vision that you're working on sustaining.
Well, the first thing I'm working on is to get a governor elected that understands we better get Medicaid expansion. That's like 1, 2, 3, and 4 of what my current issues are. On a statewide level, our healthcare system is terribly, terribly broken. As a head of a 501c3, I cannot advocate for any particular candidate. I can advocate, however, for this issue, and it's vitally important. I work with national organizations that do data collection and data sorting, and I work a lot in public health. Most of our patients fall into what Harvard calls the sacrifice zone. They make too much for meager Medicaid in Louisiana, and they don't make nearly enough for ACA or Obamacare. So we don't get reimbursed for their care. We're never going to turn them away. We'll go down fighting if we have to. But it's very important that we create an equitable system so that the healthcare disparity will go away. And so that is what I feel like I need to focus on. I need to speak on any panel that they want to hear me speak on. I need to talk to private foundations. I would love for our clinic model to be duplicated for farmers, first responders, culinary workers. I mean, I'd love for that to happen. But that's easy. Our model's great, but it's not great in this current toxic environment that we're having to operate in. We now have 2,500 patients. So when I say our first struggle was we were underwhelmed, well, now we're overwhelmed because after 18 years, we are trusted and we are the only safety net that most of our tradition bearers have between us and nothing. So if they're going to stay in New Orleans, we have to stay in New Orleans.
So when we arrived, you handed me a series of prototypes you're using to create a booklet. Tell me a little bit about what you want or hope people will know, and what people who can't be the vision or the major advocates, but what can they do to help what you're trying to achieve here?
Well, one of the things that we look at all the time is data, and we now have electronic medical records. And every one of our patients can get all their medical records on their cell phones. They know every medication they're on, they have pictures of their doctors, so no matter where they go to perform, they will never have happen what happened after Katrina. And the thing that will sustain our network is to have people donate to us. Even if it's $5 a month, it really helps because we have no funding at all to cover their health care. And I don't think people understand what that is. I don't think they have a clue what that is. But I will say that the majority of our donors are from outside of Louisiana. And when I go to a club and I see local people not put money in a tip jar, and that is the only way that those musicians get paid when they're in New Orleans. That's it, is that tip jar. I just want to go up and strangle them. So, first thing they can do is pay musicians. But this is the very unfair system, and that's why a lot of our brass bands are on the road 300 days a year, because they don't make money when they're in New Orleans. But yet they're supporting their grandmothers, their sisters, their nieces, their nephews, and it's a cash-based economy. And there's very little left to sustain their health care. We had a 28-year-old musician who died in Japan right after Jazz Fest, who never came to our clinic because he was 28 and healthy. And he had a dental infection spread to his heart and he died in Japan. So these are the things that keep us up at night, because we know how important it is to get every one of these musicians into the clinic and make sure we keep them healthy.
So I want to just touch on a few more things to make sure I get there. One, just that you've already mentioned, but make sure we cover it fully. You mentioned the public health areas that you're active in and organizations you work with. Is there anything more you want to say about that? You covered quite a bit,
Well,
but
I
want to
think
give you
that
that opportunity.
that one of the things that's been incredible are psychiatrists, diabetic educators, social workers, and public health people who realize how bad things are in Louisiana, and they become licensed in Louisiana so that they can come volunteer for our organization. And that is a great thing that people can do. Social workers, anybody who understands what goes on in ethnic communities, to be culturally sensitive is so important. And I think that a lot can be learned for what has happened in Louisiana, because there's some remarkable things that have worked. But that we still have feral children here. And we have feral children and we have heroin. And that is why there's so much crime here right now. And anybody who knows an answer to how you fix that, come on. The same governor, whose name I won't mention, has also done a great deal to destroy our public university system and our education system. I mean, you can look at the numbers however you wish. They talk about how great their charter school system is. Well, they don't talk about all the children that are flushed out of that charter system. So there's a PR version of what's going on that doesn't take into effect the terrible, terrible violence that we are living with in our community. And that is an outgrowth of poverty and flushing people out of the system so that you only count the ones you want to see.
The other thing I wanted to go back to, you had said you were scared. Your impetus for going to Lafayette and getting musicians and people you knew from the clinic back into Louisiana,
Yeah,
as soon as you could, is because you were scared of losing the culture.
right.
And I think I get that, but I think there are people who aren't going to get that. Would you talk about that a little bit more?
I will give you one example. Soon after Katrina, there was a big jazz fest in northern Denmark. And some musicians who came and played with New Orleans musicians invited me to go. And I sat in this white Viking world and I listened to German bands, Scottish bands, Danish bands, Swedish bands play a white person's version of New Orleans music. And I just sat there weeping. And my Danish friend said, "Oh, this makes you miss home." And I said, "No, it makes me realize what's going to happen to our music if I don't go home." It's like these people were born with a funkectomy. They have no clue. They don't eat red beans. They don't sit on the mama's porch. They don't go to a second line. They wouldn't know funk if it bit them. And I have to go home and make sure this doesn't happen because this is horrible.
In your opinion, has it happened? Have you been successful in making some headway into sustaining?
I feel like that I look back because I was always fascinated in the 18th and 19th century in Louisiana history. And I realized it was a German psychiatrist who showed this to me. And he said, why did jazz come from here? And he said, I'll tell you why. He said this in a very thick German, psychiatrist, whatever. And he said, slavery was all over, the southern part of North America. It was in Central America. It was in South America. But why here? And he said, because the group of people who came here realized that the only freedom they would have is producing endorphins. And he said, you look at the faces in a second line, and you look at the faces of Mardi Gras Indians, and you look and you know that they are producing endorphins. And he said, your culture will survive as long as people's main wish is to be able to create their own pleasure. And people come here to get pleasure from them. Your job is to make sure they can continue to produce it themselves. And it stuck in my mind. It really stuck in my mind. You know, if someone comes into the clinic, we're never going to say you can't play. You know, like you're too old or you're too sick. Our goal is to say we can do whatever it takes. And our oldest patient was still performing at 102. He was performing weekly gigs up until 3 months before he died, because we wanted to be sure we would do whatever it took to use any trick in the book to make sure he could do that, his band could do that, and that we all enjoyed every minute of what he did. And so, I don't know if that answers your question, but it's like, you know, I feel like if I can see joy in the eyes of the performer, that's what we got to work on. We got to get those endorphins made. And I don't think that, you know, those outside musicians who you see playing in the street, they don't have that same, this is what the psychiatrist said. He said, look at these muscles right here. Like, look at these muscles. And he said, if you watch someone play a song written by a composer from Europe, they're real good at it. But look at what, when they're playing their own music, what happens with this? And he said, that's endorphins. And I get endorphins from listening to it. I love it. And today I'm going to go hear the Meters.
Oh, you are?
With Alan Toussaint and Irma Thomas at 7 o'clock at a free concert in the square. And I will.
Is this at Lafayette Square?
Yeah.
Yeah.
Are y'all going?
We were going to try and go. Friends have already told us. The Blues and Barbecue Festival.
Yes, it's fabulous, fabulous,
down.
fabulous, fabulous. I can't wait to go. But you will see me have endorphins. I'm so happy to be there.
Fantastic. There are two things I always try to do at the end if I remember, and one is ask you if there's anything else you wanted to say that you didn't get an opportunity to say.
Oh, I think I told you way too much. You'll be so bored, like, oh God.
This has been anything but boring. I apologize the whole time. I've had something go on, it's an eyelash or something in my eye.
Oh no.
But it's just an amazing interview so far. Thank you.
Well, thank
very
you.
much.
Thanks.
But if there is anything you want to say, and then the other thing I usually do is ask Forrest and Pippa if there's anything they want to ask you, because sometimes they have questions that I would have never dreamed of.
Okay.
And of course we had nothing. I mean, she said a lot. My question, whenever I ask questions, more typically of like other issues that may have arisen that are kind of outside of what you spoke about, that actually the positives and the are there positive things that you've seen that have kind of risen about how the changing of people coming in and after treatment?
The positive thing that I have seen happen is that there are people like the psychiatrists that I mentioned who realize how vital the need is for mental health. And they come in and they come in with an entire plan. They affiliate with us and they get it done. And that is remarkable. Or people who realize that there's a problem with lack of education here, and they create really small educational, social, and art programs for a small group of kids, and they make a commitment to see those kids all the way through college. You know, it's just putting your hands around a small piece of it that I see really matter, and I think other people I've seen realize that if they don't come and do it themselves, it's not going to happen, and that's been wonderful. We had a group who came in who did ear acupuncture as a way of dealing with different addictions, anxiety, And they are here every single week, you know, and they've trained other people. It grew out of 9/11, and they said, okay, this is a huge need of New Orleans. And so they've adopted us and they've kept going. But I think the other thing we see, and I think people need to be aware of it, is after a disaster, there are some really peculiar people that will come down and want to be part of your disaster. And it's very hard to decide who's really committed and who's there because they're a disaster junkie. I think somebody could do an entire project on the lunatics that will show up versus the people who are there for the long haul. And that's a major thing. It really is, because those people who are there for the long haul are the ones who sustain you and keep you going. Because it is rough. It's really rough. I mean, there are times when you just go, okay, I don't have to do this anymore. This is horrible. I just want to stop, give up, and go away. Because it does wear you down.